Well, good afternoon and good morning to all of you all. It's great to have you all joining us, and we're so pleased to have you here as we talk about staying healthy this winter with our Healthy Mom, Strong Baby series. It's great to have a group of experts on to help us all think about all of the challenges that we're facing and we've been facing all year, but especially now around the holiday season. It's just really an important time to remind everybody of all the things we need to do to stay safe as we're still struggling in this country with COVID-19. And even on a day when we're expected to hear some good news from the FDA, we still have a ways to go to make sure that we can make it through this pandemic and survive and be healthy and thrive, not only individually, but with our families as well. I don't have to tell you all this, but the US is struggling more than most every other country around the world with respect to COVID-19, with 15 million confirmed cases, over 15 million confirmed cases, and over a quarter of a million lives that we've lost. This is one of the most incredible tragedies that we've faced in this country, certainly in my lifetime and in most of our lifetimes. We still have cases that are surging. We have states that are experiencing and being overwhelmed with cases, and ICUs being overwhelmed, with just 1.3 million cases reported just in the past 7 days alone in the US. So, this is a very serious issue, and I don't think we can state strongly enough how important it is for us to stay as safe as possible and to adhere to all the guidance that the experts are telling us about what we have to do to avoid contracting COVID-19, with hospitalizations going up and deaths rising. All of the restrictions that are being put in place or reinstituted are being done for a very good reason. And that's because our elected officials and our public health officials are all trying their best to advise us on what we all need to do to stay safe and putting in place the right restrictions that will keep the public as safe as possible. Um, this is there's also a time when we're not used to having social distancing. In fact, we're used to doing the exact opposite. We're accustomed to being together. We're accustomed to seeing families. We're accustomed to being around our loved ones and to being in close proximity to them. And so the idea that we would social distance during this holiday season is just really something that a lot of us are not ready for. We don't want to do it. We don't want to have to even think about doing it. But today we're going to have to address those issues and also really talk about what are some of the worries and the fears that so many families face, so many pregnant women face, so many moms to be and dads to be. There's so many worries, so many fears and anxieties, and we want to try to make sure that we can give everyone as much comfort and information as possible to manage through this holiday season, to manage when you've got small ones on the way or new babies that have just come as a result of or during this time of a pandemic, and really address some of the issues that we need to focus on. We know that children are not exempt or immune from contracting COVID-19. In fact, children make up about 11.5% of all the cases in the U.S. And there have been over 1 million children that have tested positive for COVID-19. A very small number of them, unfortunately, who have passed away. So we've got to make sure that we're doing everything we can to keep everybody safe, our youngest ones and our most vulnerable as well. And so I'm really pleased that we have this incredible panel of experts to help us really navigate this season, this holiday season, staying safe, preventing the spread of COVID-19, and handling the stress of this holiday season. So thank you all for joining. I'm going to introduce them one by one. I'll start with Dr. Ali Mcdodd, is a chief researcher and professor of health metrics sciences at the Institute for Health Metrics and Evaluation. He's also the chief strategy officer for the population health at University of Washington. Prior to his work and his role at the Institute for Health Metrics and Evaluation, Dr. Mcdodd worked at the CDC, and he has published groundbreaking research on local level disease trends and leading risk factors for poor health. He has been at the forefront of the COVID-19 pandemic, and he has been actively sharing IHME's early projections on disease spread and how things like masks and social distancing are vital in keeping communities safe. So thank you, Dr. Mcdodd, for joining. Our next panelist will be Amanda Galino. Sorry, Amanda is a critical care and clinical nurse specialist with Inova Health System in Northern Virginia. She has been on the forefront, as you can imagine, of the pandemic, caring for COVID-19 patients. She was personally affected by COVID-19, so I know she's got an incredible story to tell. She is also a mother of young children, so she knows what it's like to treat patients, to be a patient, and to be a mother of young children during this pandemic. And she has been a strong advocate for the importance of adhering to the public health guidelines that we are all aware of. Amanda is a doctoral candidate focused on bringing research and evidence-based practice to the bedside of acute care patients. So Amanda, thanks for joining as well. Our next panelist is Dr. Cecilia Hutto. She is a faculty member in the Division of Infectious Diseases and the Department of Pediatrics at University of Alabama. And she's been there for over 20 years, and she's also the medical director of infection control for the hospital. Prior to this, she spent 13 years at the University of Miami School of Medicine, where she directed research focused on infection during pregnancy and maternal to child transmission. In this role, she trained care providers in Africa about the diagnosis and treatment of HIV and AIDS in children, as well as the effects of antiretroviral therapy for children. So Dr. Hutto, thank you for joining. And we also have Dr. Alexis Lighton Wesley. Dr. Wesley is a psychiatrist. Her work has focused on maternal and child mental health. She is currently working with patients in the departments of psychiatry at George Washington University and at Children's National Medical Center. Previously, Dr. Wesley worked as a researcher for Yale University's Neurology Department and the University of Connecticut's Department of Psychiatry. She studied anxiety and the effects of parental emotion, regulation on children, her editorial, Postpartum Depression, a mental health crisis for Black women in the midst of COVID-19, was recently published in Blavity. I'm going to say, first of all, thank you to all of our panelists for joining us today. We're excited about this conversation. It's going to be so important. I know you all have a lot to share. I'm just going to moderate the conversation today and ask our panelists to just start with a question or two to begin, and then we'll have a group dialogue. I want to remind everybody that's listening in to this session that you are invited to put your questions in the Facebook chat. I will get them on the chat that's on my screen, and we will be taking your questions as we go through this conversation. So as things come up, go ahead and type in your question and we'll be happy to address it. So Dr. Mcdodd, let me just start with you. You've been on the forefront, as I mentioned, on tracking and projecting COVID-19 data and metrics. Can you share some of the work that you and your team are doing, what it means to be tracking and predicting the spread of this illness? How are you doing this work, and what have you been finding as you've been moving through this pandemic?
Thanks, Stacy. We've been doing this for a while now. We started the first projection on March 26th. And what we have done is at the request of our university medical hospitals. So we wanted to be prepared for the surge. As you all remember, we had the first case of COVID-19 in Seattle and the first death. What we are doing right now is we're monitoring trends and we report how many cases to expect, how much deaths, of course, but the key prediction in our estimate is how much hospital beds you need and how many ICUs you need. And to do so, we take mask wearing at each community, at each location, test how many tests are being done, how many are positive, admission to the hospitals, and deaths. We look at density of the population where you live. We look at seasonality because COVID-19 is seasonal and it's matching what we have seen before in the US with pneumonia. And we look at elevation where you live and smoking and particulate matter in your population. Lately, we've been looking at not only projections, but also deaths from COVID-19 by race and ethnicity. And we have released some of our findings where we have showed that a person at age 50, African American or Hispanic, is likely to die as much as a 65 years old white non-Hispanic. So we're calling on to now, as we roll out the vaccine, to take that into consideration and make sure we can prevent a lot of deaths as we move forward. Thank you.
What are you projecting in terms of the spread during the holiday season? I mean, a lot of communities are now experiencing this bump as a result of Thanksgiving, and that's been very scary. What are your projections telling you could happen during this holiday season if we're not careful?
So we are projecting now 4 months into the future. We are projecting 539,000 deaths in the United States by April 1st. If 95% of us wear a mask, we can reduce that mortality by 66,000 lives. So we can save family, friends, and relatives. What we are expecting by inauguration day, about 400,000 deaths in the United States, simply because we are in the middle of the winter season. We moved indoors and the virus is more likely to transmit. So we need to be more vigilant than ever before in this winter, and in order to save lives and spare our economy from further shutdowns.
Gosh, those projections just should just shock us. And to your point, if we just do what is being advised in terms of mask wearing and social distancing, we can save so many lives. And saving even one life is really important. If we could save thousands, that would be so incredibly helpful. So thank you. We'll come back to you as well. So thank you so much. Amanda, I'd like to turn to you because you are a clinical nurse specialist. You have been working in the ICU caring for COVID-19 patients. I mean, I can't even describe the pain that I have felt just listening to some of the stories of ICU nurses and doctors who've been, on the front lines, just going through this fight to save lives every single day. It is just relentless. And to share a little bit about what that experience has looked like for you, and what does it look like for the patients as well?
Sure. I think that this experience with COVID 19 has been probably one of the most challenging things that many of us who work in the critical care environment have faced. These patients that have COVID 19 are some of the sickest patients that many of us have ever taken care of. They often develop a condition called acute respiratory distress syndrome. It usually means they end up on ventilators if they're in the ICU, and they're on those ventilators for a much longer period of time than, say, other respiratory illnesses. A lot of people compare it to the flu, but what we've learned is it's really a much more terrible disease as far as all the complications it causes comparatively to the flu. And so in previous years, during a bad flu season, we might see 3 or 5 patients with ARDS, and now the majority of our COVID 19 patients develop that condition in ICU, and it means long times on the vent, lots of sedation and paralytics and other medications. And we know that that can cause bad outcomes for these patients, that if they survive, oftentimes they can develop a condition called post ICU syndrome and be disabled long term, not be able to return to their previous level of functioning. So there's a lot that comes with it. It's a very devastating illness for those who do develop that severe form. I would say for the patients, it's obviously very challenging. It's very isolating because they can't have visitors if they have COVID 19. And for the families, it's very challenging as well because in critical care at this point in history before COVID, we welcomed families into our ICU environments. They really play an important role for people who are critically ill, and we pretty much lost a majority of that with this illness. So the nurse and the doctor and the respiratory therapist have really become the pseudo family for our patients, and we have to find creative ways to communicate using things like Zoom and FaceTime, and so we are doing our best, but it is just a very tough time for everybody.
It is very tough, and to your point, you become almost like the extended family
Mm-hmm.
for many of those patients, and we're so grateful for what you do. We'll come back to you in just a little bit, but thank you for all that you've done and that you're continuing to do to help so many families. We are grateful for that. Dr. Hutto, I'd like to turn it to you because I know you're looking a lot at COVID-19 and the impact that it has on children and babies. What have you learned about the impact of the pandemic on children and on newborn babies in particular?
Right. Well, COVID-19 is very different in children and even infants than it is the rest of the population. Um, it's rare for a child to be very ill. We know that children can become infected. As you've said, the most recent data has suggested that at least 1.5 million children have been infected, that we know of have been infected in this country. But for the most part, the symptoms that children have are fairly mild. That doesn't mean that children can't become pretty fairly ill, but it's not common for children to be significantly ill with this virus. Even young babies really do fairly well, if even those that have contracted it maybe perinatally, as we know that anywhere from 1 to 3% of infants born to mothers who become infected during pregnancy. We think that at least that many may have acquired it during the birth process or prior to birth, excuse me, or prior to birth. But even for the most part, those infants even do fairly well. Some of them do require respiratory support after birth, but most of the time those are premature babies, and the respiratory support is not necessarily even related to COVID. So it's interesting, and we don't really understand why children do so well with this. The most effects on children really are indirect effects, those effects that occur because of not being able to go to school, if that's the case, and children are not in school. And there can be significant effects because of missing school and all the downsides of not being in school, or even the stress in families because of the economic situation associated with this virus. There are a lot of effects on children because of familial stress, and I suspect we'll hear a little bit about that. But for the most part, from the standpoint of clinical disease, children do much better. We don't really understand why. There are several theories about why children do better, but it's not really clear. And I think that's something that we'll learn about in the future. And it'll be it'll be important to pursue that and try to understand why children do so well.
Yeah, I think it has been fascinating about the impact on adults versus children, and we'll get into a little bit more about that. But first, I'd like to turn to Dr. Wesley. Dr. Wesley, your expertise is obviously in adult and child psychiatry, and I think Dr. Hutto just talked about this sort of the stress that so many families are facing as a result of COVID-19. Talk to us about what you've been seeing with respect to the kinds of anxiety and stress and what impact that's been having on families, on the parents as well as the children.
Yes, absolutely. There's been a huge uptick in the mental health needs for both parents and for kids. On the parent side, we're seeing them have to juggle so many stressors, grief from losing loved ones, navigating virtual school for their kids, job insecurity, social isolation, childcare issues. I think the stress goes on. And they're trying to support their kids who are also suffering from mental health challenges. The social isolation for a lot of my young kids has been so difficult. A lot of the kids that I see have so much pent up energy. They're used to being able to have outlets, have social interactions, maybe go to basketball or swimming or things that they like to do. And now they're feeling stuck in the home. And then for some of the teens that I see, there's a real sense of loss of experiences, loss of expectations, not being able to go to graduation, not being able to go to prom, feeling like you don't have the same supports that you had. And so we're seeing a lot of anxiety, a lot of depression, and it really is affecting the whole family.
When the kids are experiencing this kind of stress or even depression, what are some of the warning signs that families look out for? I mean, how do you know? What are some of the things that even parents should be aware of to sort of see if their children are really how deeply they may be struggling?
Yeah, I mean, I think, trying to come up with creative ways to keep your kid active and doing things in the home. If you're noticing that when you're trying to get your child to do something different, like something creative in the home, maybe, exercise like jumping jacks or fun things to try to keep them active. If you're noticing that your child is isolating even more than this whole pandemic is creating this isolation, I think that's some of the warning signs. If you're noticing some of the functioning changing, right, they're not even wanting to log on to school, or they're not eating or sleeping the way that they used to. I think these are signs that it's really impacting their overall mental health.
So, I think one of the things, Dr. McDodd, I'd like to come back to you because I think one of the things that we're sort of anticipating is during the holidays. I mean, there were lots of warnings that people knew to not they were asked to not travel, they were asked to not go and visit family. We know that many people did that. So what can we do during the holidays? And to the extent that, like Dr. Wesley is saying, that so many people are struggling with social isolation. I think some people might be thinking, I can't not see my family. I need to see my family. I mean, what can we do through this process? What should we be doing during the holidays? Because my concern is that we'll tell people all over again, please don't go visit your families during the holidays, and it'll happen anyway. So, what do we do to keep people safe? Is there anything we can do, or is there any other message we can be giving to people at this point?
You're quite right. We're very tired of COVID-19 and we want to see our loved ones and be with them. So, what we can do if we decide to visit, my recommendation would be first cancel it if you can. You can always celebrate at a later date, but you cannot have a loved one back if unfortunately you lose them now. If you decide to do it, isolate for 14 days. Make sure you don't bring along with you COVID-19, an uninvited guest. Everybody else in your family member should do the same and cut down on the size of your gathering. It's not a normal like what we used to do, everybody gets together. Smaller groups. Isolate. If you are flying, arrive early, test yourself, and even if you test yourself and you're negative at that date, you could still have picked something on the plane or throughout the airport. Wear a mask, stay away from your loved ones until you are sure you are COVID-19 free. So we have to be very careful. We have to protect each other. We have to protect our loved ones, especially our elders. As you've heard today, the younger population is more likely to be asymptomatic. So they don't know they have COVID-19 and they are among their family. They don't know and they're spreading the virus. So we have to be vigilant, especially at this time, and we can celebrate later.
And what about mask wearing, even if we do all those things, the testing, and if we're
Always wear it.
inside indoors, should we still be wearing our masks inside
Always
with our
wear a
family?
mask.
Always.
Always wear a mask. A mask is a lifesaver. Right now, we know the science is telling us masks do reduce the transmission. They protect each other, protect me from you, protect you from me, and keep a safe distance as much as you can. But please always wear your mask. We can save a lot of lives if we do wear a mask. Masks are not a political issue. Masks are a scientific public health preventive measure, and we should adopt them everywhere.
Amanda, I think one of the things that has been is so much in the news is the capacity issues at ICUs. You've been seeing patients that had contracted COVID. I assume some of them may not know how they got it, or maybe they do know how they got it. I mean, but every day, as an ICU nurse, you're just seeing the incoming, right, of people who now are really severely ill. If you had to tell people before they got to that point, don't do this, what would you want to be telling them to avoid doing based on the experiences of what you're seeing, of how people ended up in the ICU and why they got there and how they ended up contracting the disease?
Um, I think I would echo exactly what Dr. Dab just said, that, you know, we have to be vigilant about mask wearing. And I think that a lot of times folks are feeling that they can kind of let their guard down around their family and their friends. And I think that at this point, that's probably where a lot of the community spread is happening, even with those small gatherings. And now, as the weather gets colder, people are not able to even, have small gatherings outdoors. They're going indoors. And I think the first slight increases that we started to see were probably about 7 to 10 days after Halloween. And since then have just been steadily, increasing just nationally. So, and of course, in certain areas there were hot spots before that. But I think it's, as much as we don't want to do those things, it's the same basic things that we've been stressing all along.
Did you have patients express to you, if they were able to, that they did not realize how serious a disease it was? Were there many people that were kind of, couldn't believe that they had gotten as sick as they had gotten?
Um, I would say, to turn that question just to my own experience, I myself had COVID-19, and I was ill, fairly moderate level of illness for about a month. And I decided to be very transparent on my social media networks about how sick I was during that time period, because I think that the perception is that if you are young and healthy, that you don't get very sick from COVID. And I thought it was really important um, for the people that I'm friends with and my family to hear my story, because I had a fever for 27 consecutive days. I pretty much lost a month of my life. I was not hospitalized, I was not oxygen dependent, but I was pretty severely ill as far as someone being home. And I think that a lot of the reason I did not end up in the hospital is because I'm an ICU nurse and I know how to take care of myself, but maybe a little bit of luck in there as well. And no one really knows why, say, I got very sick, but maybe my spouse who I got it from did not. But as a mom, I think it's also important. That was a really tough time for me emotionally and psychologically, because I could not touch my children for over a month. That's the longest period of time in their lives that I have not been able to be near them. So it was very difficult for our family to get through, and we got through it. But I think that consideration, especially for a lot of listeners out there that have young babies or toddlers, how are you going to be a parent if you can't touch your child? Um, that is a really just very practical thing to ask yourself, and that really can help you guide what you're going to do this holiday season.
And Dr. Wesley, that experience just kind of speaks to the added stress that families go through when someone in the family has COVID-19, or just even if it doesn't affect the family, just the fact that it could. Um, and you've written a lot about the impact that this is having on people of color and African Americans in particular. Can you speak a little bit about what you see as sort of the disparate impact, especially with respect to the mental health for people of color as a result of COVID-19?
Yeah, people of color, in particular the African American population, have had devastating impacts of the COVID pandemic. So I've had so many families where they've experienced loss, or they, like Amanda was saying, have family that's in the hospital for months at a time, where they're separated and they can't be with their family member. So because they're disproportionately affected by COVID-19, we're also seeing the disproportionate impacts of the mental health crisis on the most at-risk families. So moms, during the postpartum period, during their pregnancy, it's a time where you're supposed to have that family support. You're supposed to be able to lean on your loved ones, and they're really not able to. And so, we already know that, single parenthood or having isolation are risk factors for postpartum depression. So we're seeing that all around. The mental health needs, depression, the anxiety are just exacerbated extensively.
And Dr. Hutto, one of the things is that we've been dealing a lot over the course of us doing these Facebook Lives with women that are pregnant, and the idea that you can't put pregnancy on pause. But you just spoke a little bit about the fact of the potential transmission of COVID-19, during pregnancy, newborns that could be impacted with COVID-19, maybe, uh, you know, during childbirth or maybe soon after childbirth. So, how are you advising families, or, to the extent that, even as a pediatrician, that you still may be interacting with women who are still pregnant? What's the advice that you're giving to women, and what are you telling patients about the risks that they may be facing while they're pregnant with COVID, and the risk of COVID-19 while being pregnant, and then during childbirth as well?
The ones that I see are women who have other children, and they're bringing in their other children for care. And when they have questions, we have to advise them, yes, you can get it while you're pregnant. Um, and you're at risk to transmit the virus to your baby. And I think you have to advise them to do the same, to take the same precautions that you would for anybody. As difficult as it is during the time when you're pregnant, to try to socially distance, to wear a mask, the same precautions for a pregnant woman as for anyone, to try to prevent it. But then if they are infected, to follow, obviously, get good prenatal care, follow guidelines from their obstetrician, and understand that yes, their baby could become infected, but it's a low risk. It's a fairly 1 to 3%. The risk is apparently greater if they have COVID near the time of delivery. The baby is more likely to have COVID. And then to try to reassure them that even if the baby becomes infected, that the risk for the baby's health, that there is some risk. Babies can get the infection, they can become ill, but most of the ones that have been reported, again, do fairly well. In the nursery, if a mother has COVID, then we're not, initially in this epidemic, it was recommended that the mothers be separated from the babies to try to prevent the baby from getting it. That has changed because it's important. Certainly, if a mother wants to breastfeed, there are no precautions against breastfeeding. That was considered, but and the virus has been found the DNA from the virus has been found in the breast milk. We don't know if infectious virus is in the breast milk. So if a woman wants to breastfeed, even if she has COVID, then there are no recommendations against breastfeeding, and there's too many benefits, and the risk is considered to be low. Some women may be, but the mother, if she breastfeeds, should try to do what she can to protect the baby from her respiratory secretions. Wear a mask, wash your hands carefully before you breastfeed. But even in the hospital, before she goes home, women are allowed to even room in with their babies, unless they're very sick. Sometimes they can't because they're too ill. And in that case, another family member may be the person that would take care of the baby, maybe feed the baby. The mother might express her milk, and then the baby could be fed with a bottle, if that's possible. But I think, they need to be aware of all those. But I think to try to prevent getting infected is the most important thing that we could probably tell a pregnant woman. I want to go back to the mask because I absolutely agree with wearing a mask. Everyone should wear a mask if they can. But from the standpoint of children, and I think most people know this, but in case you don't, a child 2 years of age and under should not wear a mask. It can be dangerous for a young child. And then there are some other young children that probably may not tolerate masks depending on certain behavioral or psychological issues, and they shouldn't be forced to wear a mask either. But I just wanted to make sure we said a child younger than 2 should not wear a mask. And that's what most hospitals would not ask children that young to wear a mask.
Exactly.
I think that's important.
That's great. It's great. That's a great advice, and thank you for reminding us of that. We do have a question from Facebook about the vaccine. Obviously, that's the big issue in the news today, even as the FDA considers a vaccine approval, even as we speak, I think. So, Dr. Mcdodd, tell us about what you think the vaccine will mean for us. And then I'd like for anyone to chime in too, you or anyone on the panel, about what we know about whether or not the vaccine will be safe for pregnant and lactating women. But just to Dr. Mcdodd, just start us off with what does this vaccine really mean? Could this vaccine really mean for us in terms of the approval and addressing this and timing issues for sure?
So the vaccine will change our lives. Unfortunately, it's coming a little bit later now because we are in our peak and our surge right now in winter, December and January. So we'll start seeing the impact of the vaccine later in the beginning of next year, sometimes in April, May. It's very important to distinguish that vaccines don't save lives. It's vaccination that saves lives. So we all have to take the vaccine in order to reach a herd immunity. And in order to ensure that happens in the United States with a new vaccine, we need to have a good communication plan to level with the American public, to tell them why this vaccine is important, how safe it is, monitor any side effect, address it, because we have a lot of anti-vaccines group out there who are very vocal and they're attacking every vaccine right now, not only COVID-19. So monitoring who's taking the vaccine, who's not, to make sure that we can address gap, to make sure it's equitably distributed around throughout our society, make sure that people at high risk, our essential workers, that their jobs require them to be out and about, they need to get the vaccine before us who are sitting at home, and then make sure that we monitor any side effect and address it. So a clear communication plan from the US government to ensure the public is safe will only allow us to reach that herd immunity, and it will change our lives sometimes mid-year.
And a lot of, I mean, obviously there's a lot of discussion about the vaccine, its safety, how effective it is, obviously. But obviously, there are a lot of people that have been very concerned about how quickly the vaccine has been developed. We have never had a vaccine developed, as quickly in any that anyone can remember. So, what can you say?
I totally, I'm going to stop you here. Let me tell you
Okay.
why. I totally disagree. Let me tell you why. Vaccines are not for months and 6 months or 7 months. We've been working on this for a long time. That technology we're talking about, the new technology, mRNA, that's 17 years old. I mean, we're working on this a long time. Yes, we had to expedite the process and the trial right now. But today, the meeting, the FDA will not approve a vaccine unless it is safe.
What would you say about
I would say the
it?
vaccines are safe. I will take any vaccine that's offered to me, approved by the FDA, and I will do it on camera. So vaccines are safe. We need to make sure.
We're gonna invite you back to Facebook Live and have a big. Hopefully, when we can all take the vaccine, we'll do it live together. How about that? Yeah, and I think it's interesting, and Amanda, I can't. It must feel like, oh my gosh, maybe there's light at the end of the tunnel, right? If we have a vaccine, I mean, does it feel like that to you? I know it's not like tomorrow or necessarily. It's not like totally immediate, but there is some hope in sight, right?
I think so. And I think that there's a lot of focus right now on, they're calling it vaccine hesitancy, even in healthcare workers. But I think there's a big difference between people being a little hesitant about something and actually doing it. So I think that maybe some of that is a little overblown. But unfortunately, I do think that there is an overall fear, just speaking to what, some of the other things that have been mentioned. But I know for myself, I will have the option of receiving this vaccine, in the near future, I would expect. And even though I've already had COVID-19, I can get it again. And therefore, I want to reduce that chance, and I will also be receiving the vaccine as soon as I'm able to. So I think, yes, it's going to be a game changer, and I think that it is one of the really great scientific advances that we should be celebrating. And I hope that, with more information, that the public will, feel less hesitant and feel less nervous and be willing to move forward, because I do think that's one of the few ways that we're going to be able to move forward as a society.
And this is really, sorry to go back to Dr. Mcdodd or any one of you all. What do we know anything potentially about how safe it would be for pregnant women or for lactating women? Have we seen any of that information as of yet?
My understanding is that no testing has been done in pregnant or lactating women yet. They're getting data together to try to probably start to see what we know about the potential, and even do trials potentially, but has not been used in pregnant women.
Yeah. So
correct. The clinical trials didn't include any pregnant women and lactating women, but this is something they are looking at carefully, because it's an important, as we all know, it's an important segment of the population, and we need to make sure it's safe for them to take.
And at the March Times, we've tried to make it a priority, and we'll continue to work on that as well, because we do want the vaccine to be available to everyone, and especially to pregnant women who, obviously could be considered part of a vulnerable population. So We have another question from Facebook about what resources are available to people who struggle with stress around the holidays. And Dr. Wesley, I'd like to turn it to you to say, if people are struggling right now, or if their children are struggling, what resources can you point them to if they need help in getting through this holiday season?
Yeah, a lot of my patients are new moms and they're struggling, trying to manage new parenthood without the same social supports that they typically would have. And so a big part of what helps for my patients are getting connected to groups. There are so many support groups, like Postpartum Support International is offering virtual support groups to stay connected with women who might be going through something similar in terms of their experience. I think a good starting point is usually to go to your pediatrician or to your primary care physician. They oftentimes can point you in the right direction about resources in your specific area. So for instance, at my hospital at Children's National, we have support groups for kids, that have anxiety and that have depression. And so getting kids connected when we're seeing that they're struggling is the most important thing that we can do.
I also worry about those grandparents, right, who are missing seeing their grandkids during the holidays. This may be the one time a year where they actually do get a chance to see their grandkids. Are there resources for people, for seniors too, for grandparents? Like, what can they do, and what can we do to really help them through the holidays as well, when they're kind of feeling isolated and alone as well, Dr. Wesley?
Yeah, I think it's such a hard situation. I think we have to acknowledge the feelings behind what they're probably experiencing, validating that it is hard for them not to be able to see that their grandkids during this time, during the holiday season that they're typically used to. But also just coming from a place of safety and, protecting their health and protecting your health and the health of your kids. So I think making sure that they have that information, but also we can get creative. Like I've seen it helped a lot of my families when they had grandparents to try to, modify some of the traditions. One of my kids is used to decorating the Christmas tree with their grandparents. So they decided to make a game out of it and have the grandparent be involved in a trivia game to pick the ornaments and watch their grandkid virtually, decorate the Christmas tree. So I think we can still have some of that holiday tradition, just with a little bit of creativity and modification, staying connected virtually, having scheduled sessions, having scheduled telehealth, not telehealth, but FaceTime visits, with your grandparents so that it's part of the routine and that you stay socially connected, though it's, not in person.
I think this is, we're so lucky to have FaceTime and Zoom to be able to talk to each other. It's really important. Although my daughter likes to laugh that when my mother-in-law speaks to her, you can only see her mouth in the screen. So we're trying to help her understand how to keep her phone far away so we can see her whole face. So, but at least we can see her, which is the most important thing. Dr. Wilson, one other question came from Facebook. Why is it that women of color may be more at risk for COVID and for depression and anxiety? Can you just talk about that a little bit?
Absolutely. So we know that women of color in general are less likely to be identified for anxiety and depression. And so even when they're struggling, we're not getting them to the places that they need to be to have the support. Also, a lot of times it's a resource issue. So like I mentioned, single parenthood or not having the same social supports are risk factors for postpartum depression and anxiety. So when women of color are experiencing that lack of social support, we're seeing more of that depression and that mental health impacts of not having the same community. And so I think it really is just a matter of trying to be better educated about how to identify these women that are higher risk. So for me, a big part of that was being in a place where we know women of color are, right? So if there's if they're not going to come to you, we have a duty to go to them. So I'm embedded in a primary care setting where I'm working with young kids and we're screening moms for postpartum depression so that, even if they're in the midst of a crisis, right? A lot of times women don't know that they're experiencing, maybe they're feeling more tired and maybe they're feeling disconnected. And for them, they don't realize that that could be a reflection of depression. So they need to have physicians there that are saying, look, this is what you're experiencing. This is how we can help you. And that there are supports out there. So I think, the burden is really on the healthcare system to reach more people that are at risk for some of these challenges that we're seeing now.
Yeah, I think it's really natural to, when we're all feeling kind of isolated and alone, to think when we're going through something, it must just be us. And I
Exactly.
think what you just said is really important, that, it's okay to feel this way. It's okay to feel stressed and feel like the world is changed and so different. And, to feel like, will this ever get better? I mean, those are all very normal feelings to be having. The question is, what can we do to reach out beyond ourselves to get the help? And I think some of those resources you mentioned are really helpful. Just as the head of an organization, the March of Dimes, it's really interesting. We do have history in vaccines. We actually, this country has actually successfully rolled out and mobilized an entire country to get everybody vaccinated. And I just want to say this because I'm very proud of this history. The March of Dimes included people of color in the clinical trials for polio. We made sure, even during a time of segregation, that Black people had access to the vaccine at the same time that white people did. We made sure in this country that everybody, everybody's life was important, and that everybody had access to, a quality of care that would save every life. And that's something I'm very proud of. And just a little point of personal privilege there about the March of Dimes. So I feel confident that we can do this, Dr. McDodd. I'm totally on board with. I'm feeling good about the vaccine. I'm feeling good about what we can do together. But we just got to hold on, right, for a little bit longer, and we cannot give up and start to let our guard down and think that, well, the vaccine is going to be soon here. If you get COVID-19, a vaccine 2 months from now is not helping you. Okay, you need help right now. And that's what we know from our ICU nurses, from Amanda, not only from her being a nurse, but from her own experience of contracting COVID, that this is something that we have to take very seriously. Are there any parting thoughts that you all have that you just want to leave the audience, that, as we get off this call and as we go into the holiday season, what's the one thing you just want to say to people to protect them, keep them safe, keep their families safe? Dr. McDodd, I'll go with you.
So I totally agree with you. We've done vaccination at scale in the US. We give flu vaccines, 3 million doses a day, when you look at how many flu vaccine and the duration. So we can do it. We have to make sure we do it right. What I would like to do is, right now we have an Operation Warp Speed in order to make sure everybody gets a vaccine. And we're in the middle of a pandemic, and we're working to control that pandemic. But also at that same time, we need a Operation Warp Speed for recovery. We're going to roll out stimulus. We're going to borrow from our children and grandchildren. We have to do it right. We can't leave anybody behind. That's very important. That's one. And in that operation, we need to be ready, and Dr. Wesley would comment on that. We need to be ready for an increased demand on mental health. Even among our medical staff, they're stressed right now, but they're keeping their head up and working day in, day out in order to take care of patients. There'll be a lot of demand on a lot of resources. We need to be ready. We need to start talking about recovery and making sure nobody is left behind, and make sure that we have all the services that are needed by our public. And make sure in this country, the last point, we need universal health care for everybody. It's our right to have health insurance. It's not somebody giving us a favor. It's our right to have it. We're the only rich country in the world that doesn't have that, and it's not acceptable. Thank you.
Oh my goodness, I love Operation Warp Speed for mental health. You couldn't say that. By the way, we even talk about the fact that this opioid crisis that was hitting us before hasn't really let up through this pandemic, and no one's been talking about that. And that's been also an underlying issue around mental health and treatment and recovery and all kinds of things for that too, which we can't ignore. Any last parting words, Dr. Wesley, for you, since we're leaving since we just mentioned a mental health angle on parting thoughts?
Yeah, and as we're going into holiday season, I would say make sure that you're working on setting your boundaries. I think COVID has really brought to the forefront the importance of setting boundaries. We want to be able to feel physically safe, And we can still care for our mental health if we just try to think of creative ways to be able to stay safe, but also prioritize our mental health, schedule those FaceTime visits with family so that becomes part of your routine. Think of things that you can still do to have, the same holiday traditions, just with a little bit of a twist. Find local support groups, use your pediatricians, your OBGYNs to see, what are the resources in your area. And then also just realize that you're not alone. There's so many people who are struggling. And if you really are struggling, it's okay to seek support. And there are individual providers that can see you for therapy or mental health support. But you just, have to be okay with knowing that you're not alone and that there are people that are willing to help.
Absolutely. Thank you for that. Amanda, any parting thoughts from you?
It's hard to top what everyone's already said, but I think just continuing with the basics, continuing with mask wearing and social distancing, and keeping it to your bubble, and just kind of knowing that there is hope in sight, and that we can get through this, like we've talked about. I think as an ICU nurse, I would say if you're looking to do something safely to help patients, it would be great if you're able to donate blood. I know lots of areas, because of COVID-19, have experienced shortages because they're just getting less donors. I know at least in this area, I've donated blood myself, and it was very safe and carefully managed. So that's something great you could do to give back to your community.
I have done that. I'm a type O blood donor, and the Red Cross loves me. They text me on a regular basis and ask me to keep coming back. Dr. Hutto, parting thoughts from you.
I think everybody has said everything well. I would just say, follow your public health guidelines, the basic guidelines, and we can prevent infections and we can save lives. Masks save lives. Do it for your family, do it for your friends, do it for your fellow human beings. But we need to wear a mask, we need to get vaccinated, and maybe next year things will be much different.
Much different. That's right. Before we go, Dr. McDodd, one quick question. If I got someone asked on Facebook, if I got a flu vaccine, can I get a COVID vaccine? Is that safe?
I did get a flu vaccine, and I will get a COVID-19 vaccine. And my family did, my wife and my daughter. So that's the best answer, I guess.
And if someone has other health issues, probably good to ask your doctor
Yes.
when you can have the COVID vaccine, if it's safe for you. So I would sort of leave us with that. Thank you all so much. This is awesome. You guys were terrific, and I appreciate your time. I know how valuable and how your time is and how busy you all are, so we're grateful. I just want to leave everyone with some additional resources. There are a ton of links and resources that hopefully we're making available here. Some of them that were mentioned already. With the March of Dimes, we've got a bunch of resources. There are mental health resources with the Maternal Mental Health Leadership Alliance. If you're pregnant or a new mom and you need some help with mental health support, the American Academy of Pediatrics has some incredible resources, as well as ACOG. I think Dr. Wesley mentioned Postpartum Support International is a great resource, and Dr. McDodd's organization, Institute for Health Metrics and Evaluation, we're so grateful for the work they've been doing through this pandemic. We've learned, and we've been so tracking everything that has come from the Institute. It's been helpful. Of course, CDC has always done a terrific job in helping us through the pandemic. So if you need more resources, need more information, please go there. Also, because it is the holidays, and to Amanda's point, if you're looking for something nice to do for someone else, or for the March of Dimes, we would certainly welcome any of your support. Your support has actually made it possible for us to do what we're doing, and helping to be there for moms and babies and for families throughout this pandemic. So you're doing your holiday shopping. I know you're doing it online. So just sign up for Amazon Smile, because if you sign up for Amazon Smile with your purchases, some percentage of that goes to benefit us at the March of Dimes. Once you sign up, you just sign up and go. Every time you purchase, you don't have to keep doing it over and over again. You sign up one time, and every time you purchase, support will come to the March of Dimes, and we would greatly, greatly appreciate it. This has been fantastic. I want to wish everybody a very happy and safe holiday season. Please be mindful of everything that we've shared today. Please be mindful of keeping yourself safe and your family safe. It is so critical and so important. And as we keep our fingers crossed with the FDA today, we are excited about the possibility that we might have some light at the end of this tunnel and get to a better place in this country and around the world with respect to a solution to COVID-19. So thank you all so much to the panelists for joining us, and we're grateful to have you all, and we will see you early next year. Thank you.